Welcome, all of you out in Zoom land and all you future viewers and everybody here in K1C at Central Law School in Philadelphia to an hour of discussion about AI and law and legal research and health. The Center for Public Health Law Research here at Temple has as one of its main tasks trying to create open source legal data that capture the attributes of the law in a manner that allows them in a digitized numeric form that allows the text of the law to be changed into numbers and then to be projected out into all the different kinds of places that numbers can go in the world. This is something we've been doing for more than a dozen years at the center, of practice we call policy surveillance, that we've been trying to spread methods of scientific legal mapping, all in the service of a field we call legal epidemiology, the scientific study of the health effects of laws and legal practices. Gradually, and now apparently inexorably, the world of computer science has kind of arrived at a place where it can ingest and use legal data like we make, as well as all sorts of other legal data, and explore the patterns, synergies, contradictions, relationships among all that world of data, and spit out intelligible information.
No, it's not. It's not. It'll be fine. Just hit OK.
Oh, you're sure about that? Right?
Yeah.
Okay.
It happens all the time when we're teaching.
Okay.
The problem is we're just people and the computers are much smarter. But even the computer scientists, I thought, well, he'll show us how to use Zoom. We'll learn some tricks. But
I
no. So we have been very interested in our center in trying to think about what possibilities AI offers to us across the board in our work, from finding the law that we think is interesting for doing legal research to what we call coding the law, identifying the attributes of law that are important and changing those into numbers, and then of course doing analysis of what effects that law is having. A few months ago, Professor Klaus Mueller, our keynote speaker here, was a professor at the computer science department at Stony Brook University. And he's also a senior scientist at the Computational Science Initiative at Brookhaven National Lab. You can look him up, Google him, see his webpage, lots of information. I won't spend more time in introductions, given that AI has taken, computers have obviated the need for introductions. But Klaus called me up and said he was doing some work that had made him be aware of legal epidemiology, and he's interested in learning more. And since then, we've now got 2 funded projects and a bunch of other notional stuff we're playing with. And so I invited him to come down and talk about some of the interesting things he does with and without law in his work as a computer scientist. I've also asked our own Temple College of Public Health professor, Priscilla Malakari, to come and talk to us about what this means from her point of view as somebody who does evaluation research using more conventional methods in the health policy and law area. And I thought this would give us a nice opportunity as lawyers and as researchers to think about where we stand with AI. What are some of the possibilities? What are some of the pitfalls? And maybe what are some of the false dichotomies between human and computer intelligence that get in the way of our ability to use machines effectively in our existing institutions and funding frameworks. So without more, I'm going to turn it over to Dr. Mueller.
Okay. Thanks a lot. Thanks a lot. So thanks a lot for coming and joining for the lunch break. So actually, the title was forced on me. So I call it forced, just to be on the safe side. But I think we'll get there. Now we have these 2 grant funded or, just emerging, so you should be able to remove that port too. So, just a little bit about myself, there's this word cloud, since it's a visualization, so my main topic is visualization, but try to, so it's basically all my titles, paper titles. And really overarching theme is really to put the human into the data analytics loop, right? There's all these conversion people try to eliminate the human, try to actually empower the human, become more, it's like an exoskeleton to the human intelligence, right? Because I think the real human AI is still far away, right? So we just make the best use of get the human involved. So there's something that is sort of very core of my research is called this concept of visual analytics, which is really three things. It's like visualization, that's like, and then there's the analytics, the ML and the AI on it, and then there's interaction. Basically, the human interacts with the visualization, and the visualization interacts with the human, so they can learn from each other. The ML algorithm can inform the human. Yeah. Oh, okay. So, okay, and then basically the three things we're going to talk about is explore high-dimensional data. I'll show you some techniques, or one technique I'm thinking about using as part of this interface we'll be developing. And because these data are multivariate, and you need to see them and extract multivariate patterns. I'll show you some techniques on that, which we published recently, and then techniques that discover causation among these multivariate attributes. Okay. So first, explore high-dimensional data. So you're probably very used to these kind of things, the pie charts, bar charts, line plots, right? These are sort of the common library of what you think of visualization. People usually use this, right? And they're really useful. They're good. Tableau has it, and then all of these softwares have it, right? Excel and you name them have it. It's good. They give summary statistics. They give trends over time. But they're really not that great if you really want to look for high-dimensional relations, right? You want to really understand how different variables all interact with one another. So I want to introduce something called parallel coordinates. I'm not sure if you heard about this, but every time I show this to people that don't know it, they always like, especially because it's interactive and you can really see things that they really couldn't see before, right? So I showed it to public health practitioners, I showed it to doctors, business analysts, they all like it for some reason, eventually when I show them how it works. So basically what it is, it's like you have these vertical axes, and each axis is basically one attribute, and then you just plot the point. You just label its value on each axis and connect them with this something called polyline, right? So now you can see there's a car, it has like mid-range mile per gallon, it has like 4 cylinders, it has a low horsepower, has a high weight, and acceleration and so on, right? So it has this, so you can sort of see this as a picture, right? In one plot, you can learn about this car. It's better than looking at the whole inspection, right? So now when you have more cars, it becomes like very, very intimidating, overplotted kind of mess, right? So that can hide relationships. But what you can do is you can find clusters in them and then color them with different colors. And you can show the mean of these clusters. Now you can sort of learn about cars. You can learn that cars with high cylinders, lots of cylinders, they have really good horsepower. They're also very heavy, but they don't get good mile per gallon, right? And while the cars that don't have a lot of cylinders, they don't have a lot of horsepower, they don't have a lot of weight, and then they have much better mile per gallon, right? And there's other things with it, right? So now there's some causality already you can see from this, but you can already understand. So these are the sort of the trade-offs I have to make, right? So I want car with more oomph, then I have to, I have to pay more for the car. I have to get more gas, something like this, right? So that's parallel coordinate, right? And then you can make it more pleasing to look at, which we published a long time ago, that you can just basically take these patterns instead and just abstract them into these envelopes, right? It looks like Excel now, right? And people tend to like this. We do user studies on this, and people tend to like this. So, that's as far as I want to go for this lecture with this. And the next thing is, now you have these data, you want to see patterns, right? Actually, patterns. So what is a pattern, right? A pattern is a subgroup of data points that share similar characteristics or features, right? They're similar in some way, okay? So, but similar in some way, given a certain target I'm looking for, right? For example, set of similar US counties associated with a COVID-19 death rate that's higher on average than the overall county average, okay? That's a good goal to find, right? You find out why are these counties have higher death rate? What is it about those counties? Okay. And then we have an algorithm that is called subgroup discovery. There's various ways you can do this. I'm not gonna talk much about them, but there's various ways in which you can automatically find them. Okay, so you can just throw this high dimensional data set on it, let this agent go run, look for these subgroups, and then return it to me, right? So there's no user interaction needed at all. It's just all automatic within a few minutes. It's highly optimized. Okay, it's not that simple, but we accomplished it. And then, so just to give you a little bit of ugly mess, let's look at the pattern that has 3 factors. Okay, and I'll show you 1 factor at the beginning. Okay, so this is basically each of these dots is a county, US county. There's 3,003 of them, I think. And so the counties that are not in the pattern that I'm going to show you are the ones in purple, and the ones that are in the pattern are the ones in green. Okay, and then there's this gray box. Okay, so basically, and the target curve is the death rate, like the death rate of COVID-19. This is like from May 2020, and so higher up there's a log function. Okay, it's a log scale. So higher up, more death rate this county had. Okay, and then you'll see basically pattern. The factor here that the program found is county poverty rate. Okay, so county poverty rate, and so as you look at it, the gray box is the set of US counties where the death rate was significantly higher than the average of the nation. Okay, within as national counts. So here's the death rate average over all US counties, like generally, and here's the death rate that is the gray box set of counties. It's a little higher. Okay, so you see, this is interesting, right? Why are these counties more vulnerable to that? Right? So, and then there's some counties here that have a really high death rate. But as you can see in this pattern, there's still some purple points, right? I told you the purple points are not part of the pattern. So we'll have to do a little more digging. Okay, so the program identified another variable, which is the percent population aged over 65. I took these counties, these counties in a gray box and tried to refine them more. Okay, the other ones already out, right? We already know them up. So I think that's why there's fewer counties plotted here. So we'll see. Okay, now again we were able to get rid of some of those purple ones that are not in the pattern, but still some are there. And this is based on the population aged over 65. Death rate is the same than before, right? The average death rate of this pattern is higher than the US death rate, and still these counties are there. I don't know which they are, but still, remember, there's still some purple counties in there, so we have to do one more. We have to find one more attribute, which is this one, population density. So this is the low population density on the left side. Right. So now basically we eliminated all the purple ones and have only the green ones in there, and basically the same thing as before, right? So now these guys up here in the higher above the average, those are the really sick ones, and the one below are the so far healthy ones, right? And that's very important to see, because those guys that are healthy, they're jumping around happily by, I'm COVID-19. Who cares about COVID-19? It's a hoax. But they have the pattern that would expose them. Someone go visit them and cough at them, they may get it, right? So this is predictive, right? I can tell you, you guys should be careful. You could catch it if you're not paying attention, right? You should do some preventive medicine, right, to mitigate and try to wear a mask and so on, right? You can give advice to them. So far they're good, but they could rise because they fit this pattern, right? And actually, when you look at this, the third factor fully separates the in pattern from the out pattern. So we have statistical tests we use for this, and it's not like magic. So this is hypothesis testing, but it's done automatically, right? We basically run thousands of hypotheses. We run them in parallel, and then we verify some of them come true, some of them don't, right? So all of these hypotheses are run automatically, right? We do like what statisticians have to do is manually, right? And we just run them automatically all at once, right? In 5 minutes, we test all hypotheses that could exist, right? And then we show those dependencies, right? And then you see high poverty rate has to be there, and high percentage of older people, and low population density. These 3 things have to be there at the same time, right? 2 of them is not enough. All 3 have to be there at the same time. These are joint conditions, right? And There could be other risks. It doesn't have to be COVID-19, but we're very interested in that. And the counties are here, so that's where the counties are. You can see geographic, very distributed, right? There's like, we found like there was a county in Texas that was really similar to a county in upstate Michigan, right? That's very interesting because they have certain patterns that are similar. Okay, here there's, you see that pretty well distinguished. So we found actually 297 patterns in this analysis in May 2020, and they had 1, 2, or 3 factors in them, and they were all easy to describe. Actually, it's very interesting when you look at these. When you look at these descriptions, you can sort of imagine why they go together. For example, this one here: sleep deprived, uninsured, uneducated. Right. So basically, sleep deprived because they work a lot of jobs, still can't really pay the insurance, and they don't have education. That's why they have to work so many jobs. Right. They don't have cushy jobs like work 8 hours because they have nice college degrees. Right. They have to work 2 or 3 jobs. Right. That's why they're uninsured, but they're very highly vulnerable. Low Asian popularity is another population, is one minority and poor Black population. Some of them are a little more like out there, right? Don't really understand quite why they are, but they are exist, right? This is like a little bit out of the box thinking. So in any case, right? So they have strong predictive capability because we actually did the same analysis in June, July, August 2020, and we showed that 98 of these patterns we found, they actually had a growth of the COVID-19 death rate 2 to 3 times higher than the US average. So they really grew, right? Those guys below there, they really went and climbed up, right? They really, like Tinder, right? They basically, got infected and infected everyone else around. Right? And actually 2% grew at average pace. There's actually some late bloomers. Some of them in June didn't grow yet, but they then surely grew in July. It's very interesting to look at the plots we made and that we published in this paper that I told before here. And we built a dashboard on this to allow people to explore that stuff, right? So here's like the user interface for this dashboard. And so it's interactive. So there's this risk pattern browser on the bottom. There's one county selected, you see in Texas, I think, on the left. You can see this little bit yellow around. There's this, I forget what it's called. Oh, it's here. I can't read it. It's called. I can't read it from here. I should bring my glasses. It's up on the right, next to the line block. There's a name. It's in Texas, I think. Hold on. I can't read. And so anyway, these are the patterns this county has, right? So counties don't have just one pattern. They usually have a lot of them. So that's so now you can compare them like pattern by pattern. You can see that this pattern is like all these counties have this pattern, and you can click on the next pattern. All these counties have this pattern, and up here on the top, you basically see you can select a pattern, right? And then you see this information panel that shows you the risk factors of the currently selected pattern on the bottom. These are the 3 risk factors it has, and I'll explain a little more on this in the next slide. And there's the geomap that shows you like where they are. You can click on them and then compare them. You can everywhere you can click, right? And on top is the county information panel that shows you like what are the top 3 risk factors for this county. Basically, we took all the panels it has and looked at what were the common risk factors among all these panels and then ranked them. Okay, so now you can see these are the 3 risk factors. So there's a picture of this, right? So the pattern was like PM25 particle matter pollution. That was like, elevated. This was the pattern. And the pattern range is in blue, and the US range is in gray. Percent adults with frequent physical distress, also high up, and percent minority population, also high up, right? And up here is the other one, right? Where we now compare the US range with the state range in which the county lies, and the US average and the county average. What you can see, for example, average GPA, US average is higher than the county's average, but the state overall is not that bad. Okay, percent population without high school degree. There's also the solid marker, vertical marker is the county, and then the US average is the dotted line. It's much less educated, and then percent minority population is also way high. Right, there's a lot more minority living in this county than in the US. You can basically learn about each pattern. You can figure out what they are. And we showed some nice, we have this paper here, that one actually best paper award at AMIA, that kind of gives like a nice story that would allow you, a policymaker, to make up a nice story to warn a certain county about the risk that they have, right? And to show them with an example, like here is this is what you have, and this is this other county up here, has the same pattern that you have, but already has fought successfully COVID-19. They wear the mask, they close the schools. You can learn from them and do the same thing. So we're starting right now. We have a paper that we're trying to write about how effective this storytelling really is for a person. Trying to do that. So now comes discover causal relations. So let's see if we can actually come up with some causalities. Okay. So you have this multivariate data set, right? And you want to do some more different analysis. Want to do some interventions. Want to see, like, what if I increase this here? What would it have on the output, right? So we're going to do this. So method we're using is something called a PC algorithm, which is a method. It's probably about most popular one. It does like conditioning analysis, figure out the initial structure of causal model, right? And this initial, okay, it's just a start. It's never perfectly, because the data aren't usually perfect. So you have to do a little bit of editing on your own. So by using a domain expert would usually edit that. And then you have a user interface for this. And then we use structural equation modeling, or SEM, to compute those beta coefficients on those edges, right? So let's look at one of those causal DAGs. The directed acyclic graph. This is my favorite topic, cars. Germans always like cars. So anyway, that's my weakness, I guess. So not that I have anything that I could talk about that I could brag about, but I still like them. So anyway, so you can sort of learn about these cars. Remember, like I showed you this kind of content with all these lines. Right now, you can actually see those relationships expressed in this graph. Right? You can learn about horsepower. Horsepower up here on the top. Right? I'm not sure if there's a pointer. Horsepower on the top has a negative effect on time it takes to go to 60 miles an hour. Right? So because more horsepower, less time you need. And there is this if you know about cars, there's the cylinders. More cylinders give you more displacement. If you know about cars, there's the bigger engine. And then more displacement gives you more horsepower. The big engine, more horsepower, less time. But unfortunately, like the displacement also causes more weight, because you need it. This is from the 80s. These are like the pure cars, right? No fancy technology there, right? Just a metal and an engine that makes a lot of noise and gas and some other gas. And though that causes more weight, and the weight has like this increasing effect on time it takes to go to 60 miles an hour, has also a detrimental effect on the miles per gallon, which is right. So it's all expressed in this causal graph, right? You can just read it off and read it, right? It's a little, it's a DAG, and then we did another work to show, like, if you have a particular like goal in mind, like an outcome variable in mind, like for example, time it takes to go to 60 miles an hour, right? So you make this the outcome variable, the one you're interested in studying and do interventions on, right? So we make this path diagram. So you can rewrite this DAG, make a path diagram out of it, and make it a little fancy looking. And it's basically the same thing. It's just now more in the flow, where you can really see from left to right how these variables affect each other, right? We publish this also. And so you can edit the model, of course, with this part. You can, for example, say, oh man, maybe displacement could cause mild. You can basically post the hypothesis. That's what you say. Oh, isn't displacement related to mile per gallon? More engine, isn't it direct? And you can test it with something called Bayesian information criterion, or big score, that tells you the trade-off of this, right? It may reduce the sum of squares, the residual sum of residual error, but it might make the model more complex, right? There's like this logarithm K, right? You want to like make models simple at the same, so you don't want to gain explanatory power by making the model more complex. So this turns out to be a negative big score. So the edge doesn't really help much in making the model better. It doesn't really remove much of the error. That's right. So you can basically say, okay, this edge doesn't exist, which I find interesting, because if you want to create a bigger engine, it doesn't automatically cause the miles per hour to go down, right? It goes through the weight, right? Look at the weight, like displacement, weight, mile per gallon, right? This is the holy path, right? This is where you can do something engineering. You can say, I want to make a bigger engine, but I don't really have more mile per gallon, but you don't have to, because you can just make the weight less. You can make better car. You can just play some tricks with the framing, right? You get you can get both. You can have the cake and eat it too, right? So it's a good informative graph for engineers, right? You can really get some data-driven engineering advice out of this, right? And so now we did some. This is another paper we wrote that you can get different models or different groups, right? So you have like different causal models for different groups. We discovered this back then when we wrote this paper, but now we're using it again, because when you have subgroups, they might have slightly different causal models, right? Some edges might not even exist. Some edges have low weight, some edges have more weight. It's very personalized kind of medicine almost, like, because so basically this is a different data set, the red, the blue, and the sales data set, I think. And they have like basically slightly different causal models, right? So first you group them, and then you find the causal models for each group and explain how they work by themselves, right? So it's actually a pretty good technique, right? So they can also, this is another data set from atmospheric science, that you have basically, we divided the ocean, I think it was the ocean, worked with atmospheric scientists, we divided the ocean into squares, and then found causal models about like the different ocean dynamics they had. I don't remember exactly how it works anymore. And we basically found out there's certain parts in the ocean where it has similar dynamics than in other parts of the ocean. So we found these causal models. So we can basically make the causal model a vector by basically taking the graph and making a vector out of it with the weights, right? And then compare those vectors with one another, and then we can cluster them on the bottom left. And we can make this matrix that's basically the ocean in latitude and longitude. And then we can pool them, right? We can say, okay, these parts of the ocean are similar, these parts of the ocean are similar, and then make different polar graphs for it. We did that as well. Then we can do what if analysis. You can actually do real what if analysis. You can say, this is another paper we wrote, Outcome Explorer, where this is about house price. Okay, we're going to figure out, what are the factors that go with house price, and how can I make my house? What can I do to make the house price lower? Because I want to buy one, right? And then you can try to you can make the purple one, the orange one is a comparison, and the green one is what I want to get, like where I want to play with. And the task was like I shouldn't deviate too much from the real one. And so there is like these plots here that tell you a little bit about the exploratory effort, how it sort of worked. And then also how realistic is my configuration now, right? Is it like totally unrealistic? It's called a realism meter, where you can basically see how is it like, how much is the configuration that I have deviating from what I know about house price? Okay, so if I'm like way out there, then that house is unrealistic, right? So don't even explore. So we compare it with the distribution we know already about. It's also pretty handy to have. So now connecting this to law and public health. So this is like the holy grail, right? So we actually did some homework for the grant proposal. So we went and I got some master students and four of them, they worked busily. Like every week I met with them, and they've been like doing this. They took a bunch of data sets and tried to like bring them, so fuse them together. So we can use them in a pattern mining and in causal analysis. So we took these 241 socioeconomic risk factors that I already had from the COVID-19 analysis, that is particle matter convolution. Then we found some new data sets, an interesting classification into 15 community types, and Fox News viewership from the American Communities Project. Dynata is a company that does these phone interviews. It's kind of interesting. I'm not sure. It didn't seem to make a big causal effect on it, but we have to do more exploration. So basically, it takes all the United States and classifies each county into 15 different community types, like elder counties, counties with agriculture, college counties, stuff like this. And then based on that, you can predict how much Fox they watch. Right? I don't know how reliable this really is, but it's the best I could find. Okay. And then another one that's I found really interesting from New York Times, also Dynata also collected that to mask wearing mandate compliance. Right? They did phone interviews and asked people, hey, when you leave the house, how likely is it that you wear a mask? Okay, and then they made this map out of it. They could actually predict how likely is it that two people have both when they meet have both wearing a mask. But we want to do more like use this to show how compliant people are to mandates, right? You know, they may ignore them, right? I mean, that's the best I could find, right? I want to measure like county, if you have a county and you give them a law or policy, how likely are they going to be following it or not, right? I thought this kind of a proxy to it, but you know, that's like they do. And then we have a data set voting preferences, like we can tell like county-wise, like how much they voted for Republican, Democrat, or on the percentage-wise COVID policy data we got from the law center. The CASP is one, and the boards we did another one. And COVID death and infection rates, there's a GitHub repository that has a lot of this. And so progress, some of these early stage, basically what we want to do, explore those patterns first, and then find features and subgroups, like what is it, a feature and subgroup? Because when you do causal analysis, there's a lot of covariates possibly, right? So you have to somehow reduce those covariates, those confounders, right? Really have to minimize them. That's a basic rule, because if you have too many of them, they all take away each other's significance, right? So you gotta like make them less. So with feature analysis, with the subgroup finding that I showed before, hopefully we can sort of narrow it down to a bunch of features, maybe different features of different subgroups. That would be true too. Anyway, the causal graphs per subgroup or overall hopefully are much less than that. And then you can then construct these causal models, and then you can do interventions. We've done that already. Like we can actually increase. Let's say what happens if people have more high school degrees. So what happens if people, you know, wear more masks? Or what is when people, you know, have sleep more, stuff like this. But you can just see well, how much less COVID-19 will they get, right? We can use this causal model for that, right? There's heterogeneous treatment effects. Also, we observed this in our studies, because even though you intervene, there might be some counties that for them it's actually opposite using the causal model. For some counties it's better, for some counties not no effect, right? So these are the heterogeneous treatment effects. There's some very famous papers on this, like Susan Athley, for example. It's a very, you have to use, when you do causal analysis, you must find subgroups, right? If you don't do this, everything washes out, right? You have to find subgroups first, and then that takes care of these heterogeneous treatment effects. And then we have also done some work on forecasting COVID-19 death rate at counties that had intervened, that had like some sort of law or policy enacted, to predict how would they have done if they hadn't done the intervention. So we still more work to be done here, but it's, you know, it's this ARIMA basically, you know, to find out these forecasts, and then you can compute difference of differences. You can see like how much did it grow in respect to the ones that didn't grow, where they actually used the mandate. You can do the difference of differences, find out, you know, what is the difference, and then you can explore the patterns for that again, of course. And then you can make a dashboard that allows you to explore this. The expert one would probably have like a color coded display, and then more amateur people would maybe not. They get more like one that I showed you before. So that's it. Little more than 25 minutes, but
Thank you very much. Before we have Phil make some further comments to this, are there any sort of technical or pressing, you know, just to understand what's happened so far, questions that anyone wants to ask?
Can I ask one?
Sure.
Oh, sorry. Just so your analysis on what if the causal aspects. Can you just tell us how it's different than regression analysis? So if I fit a regression model, let's say,
Yeah.
I can always say that, you know, if you increase sleep that many hours, that corresponds whatever.
I mean, it's basically in the end, it's a regression model too, right? It's a multivariate regression with lots of path analysis. I mean, you can do this with regression model too. The nice thing with this is it's just very fast to find those regression models, right? You don't have to, I don't know, maybe you have a good hand at it, or maybe you have good tools for this. But it's like, what I like about this is it just kind of falls out very quickly, right? You basically take the data in, there's this machine, then it comes out, right, and then you do a little bit of tinkering, and then you got it, right? So it's this very, it's a, you know.
But it's not a black box, you know what it's doing.
I know, I mean, I
But
show you
then-
the patterns, I tell you what
But I
it
mean,
is.
you know what you essentially know the regression analysis.
I know,
Right,
of
yeah,
course,
yeah.
I show all of this, right? I
But
show you
then-
the betas, I show you I can identify confounders, I can minimize them, which is a big problem, right? And I can show you even, now we have some interesting work that we use ChatGTP. It's funny, but it really works. You tell it, how do you think like this affects another thing? Is this leading to this? And then ChatGTP actually will tell you, oh, it's because of this. And then you ask it reverse and ask it, and then it may also say the same thing. Then you know, okay, the first one was right. Sometimes it actually says the opposite, which is interesting, the explanation, because then you know it only applies to certain groups. There's one relation applied to this group, another relation applies to another group. It was like somebody's depression, right? Overweight and depression. Some people say depression leads to overweight and overweight leads to depression. So there's like both, they kind of both there. It's like a vicious cycle almost. ChatGTP found out.
Yeah.
And
But then that's
and
kind
it
of
shows the latent variables too, which you
Yeah.
can stop.
so that's kind of an association study, though. I mean, how is that causal?
Well, then you make the network out of it, right? And then you see the conditionings, right? You can see like how these variables affect each other. It's kind of more like what can I say? It's like more like a bigger model, like very comprehensive. That's why I really want to have as many factors in there as possible, the whole ecosystem of factors, to really explain it. So I remember one time some people gave me some data that was very, very narrow scope, and I couldn't find anything. And then I got myself bigger, more data, like more context, like demographics and ecosystems and things like this. I could actually create a nice, and the causal model comes out right. If you don't give that, the PC algorithm doesn't know what to do. It doesn't have enough. So we introduced, for example, we had a data set where we used GPA and SAT scores and statement of purpose to predict admission to a college. And couldn't do it. We had to introduce internal latent factors called aptitude English, aptitude for math. The latent factors that we just did confirmatory factor analysis to find out. And then once these were perfectly integrated into a model, the structural causal model looked great. That's the power of it, right? It basically you get a little bit of an explanation for it, right? It's a regression model. It's not as explanatory to at least not to layman maybe, but if you get this causal analysis, it explains the world for you, right? Like if you put enough factors in there, it's really because it's oftentimes very complicated, right? So then you really see, okay, interesting, this one, this has all an effect, I think that's the power. I'm not saying it's different than regression analysis, it's just more bigger.
We're setting up Priscilla's comments, so I'll just go to Ross for your.
So just really quickly, just with regard to the types of networking that you do, I mean, one of the assumptions is that there are already sort of created extent data sets that you're working with. I mean, that as contrasted with this sort of being able to look at 100 counties, for example, and the laws in 100 counties and finding patterns within the laws in those counties. I mean,
Well, though we try to find patterns but the laws aren't yet we haven't really looked at laws yet.
okay,
But we looked at other conditions, other explanations.
But I mean, but if we were to have, for example, like you would this presupposes that there would be a data set that says, here are the COVID response measures that have been done, and someone has already developed that data set that you are then merging with these other demographic.
I think we could.
Okay.
We could prove that we could make a model. It also depends, like, we have to first compare apples and apples and oranges, right? So first find the apples and then apply the law to them and see which apples have gotten the law and which one didn't, and then compare them.
The parallel plots will be quite interesting for that, because you can take the attributes of laws and put them on that kind of parallel plot, and you will then start to see that actually they differ on each of these spectra, and that complex relationship can then turn into 4 types. And then that goes into the COVID Explorer, and then you see, well, actually, this type works, this, whatever. But I should turn it over to Priscilla, because she's gonna talk a little bit about these sort of causal inference questions, and oh,
There's a question in the chat.
there's a question in the chat. Okay, can you read the question in the chat?
Don't have it.
Oh, I can, I should be able to read it?
Yeah.
You're supposed to know Zoom.
Oh, it's, well, I eliminated the. Minimize the.
If you hit escape on the.
Escape, right?
Yeah.
Escape.
There you go. Up in
Chat,
the
okay,
Q&A.
Oh, I see. Oh, in the chat.
Q&A, I think she wants.
So call.
Q&A, no, Q&A, Q&A.
Oh,
Q&A.
there's a Q&A.
Read it.
Okay,
See,
so.
I will. How does specification bias play into these methods? Ho and Rubin have a great paper showing that a different smoothing, linearity, homogeneity assumptions produce different findings about effects of legal process.
Okay.
Put the whole site into the chat, please.
So, okay, I have to go to the closer. So what is? Smoothing, I don't know. What the smoothing levels.
Well, I mean, like here he's talking about, like, are we talking about sensitivity analysis, which is that depending on how we specify the model, we might find different effects of things, right? That's really what he's talking to here. He's talking about specification bias, which is like what we put into the model and what we don't put into the model, or
In terms of variables.
to Rajai's point here, how is this different than regression? Well, I'm gonna, Priscilla, you're probably gonna talk about this, so you go ahead and.
Yeah, let's let Priscilla come up and do her bit, and then we'll come back.
Question is very, very involved,
Yeah,
and it,
yeah.
it really talks about causality and how that is addressing specification bias, and that's also, I think.
But let's let Priscilla come up and then we'll follow up.
Okay.
Now, we
So
can
who's
you
this
get
question?
her, let's see if we can get her presentation.
Oh, yeah.
The real issue here is the high dimensionality. It's just
Stop
that
share.
we can't use basic regression analysis.
And then
So-
counterfactual. Potential.
I'll leave it.
Well.
I'm curious about how to play the model.
Here's the strength here is really that identification subject, right? Because we have to
Yeah,
explore that
that's
stuff with interaction. And it'll take us days and weeks and months, even like understand.
Behavioral change.
Yeah.
So there's that, piece, right? And then you end up with the structural equation modeling, which is the, like, not advanced model, right? I mean.
Okay, we're gonna turn it over to
They're
Priscilla,
not specification model.
and
That's the end.
people are getting a little more pizza, which I encourage people to do.
In my own opinion.
And then we'll have a couple of minutes to have further discussions about what we're actually doing when we do causal inference with these tools versus traditional tools.
Sure.
No.
Thank you for inviting me to this conversation. I'm really excited. I did not see the slides beforehand, but I was happy to see that there's like some good overlap in things that we can talk about. So I wanted to start by I wanted to talk about two things. One is a little bit of the lessons learned from using AI predictive tools during the COVID campaign. These are 3 systematic review of the literature. So sorry, the screenshot stopped sharing. So sorry.
Well, that was me, I did that.
Oh. The green one, you have to go on the green.
Yeah.
You want to share the screen?
Yeah.
You have to go to the green arrow on the video.
So hover over Bethany's picture.
No, the green arrow, just click, oh, now you can share on.
So these are pretty systematic reviews of the literature that talk about, they reviewed hundreds of AI strategic tools, looking at COVID-19 diagnosis, prognosis, and pandemic preparedness. And they arrived to some conclusions. But it's sort of like a good news, bad news story. The bad news is that a lot of the models that they found, a lot of the AI tools that they found were not very applicable to the real world. And also a lot of those models were not were just performing as well as a regular a traditional statistical model, just like the regression, logistic regression. The good news is that there are some very sort of important key lessons that we can learn from this, and we can apply public health in general and legal epidemiology. So I'm going to talk a little bit about these key lessons. The first one is about data and data quality, right? So these models should be trained in large enough data sets that have high quality, and they're also appropriate to answer the research questions. Right, so if I want to know the predictors of particular disease in the population, but I only have data from hospitalized patients, I might have a problem. And so data quality and sort of like the matching of the research question with the data they have. So this is a very basic issue. The second issue is about the importance of expert knowledge. Right, so the idea that some of these tools might be biased if they are not integrated with expert knowledge, right? So as an example, we see that some of these AI predictive models, they sort of reproduce discrimination and might even increase disparities in access to treatment for people of color and other disadvantaged populations. Because they're just reproducing the sort of the inequalities that we have in the data and society. And the third thing is that it's really important to understand the limitations of these models and how we can use them to make decisions, because this is what we really want to do, right? So that takes us to the second. I don't know if I can move this up because, well, this is just a box that says prediction. Because we know that AI is very good at making predictions, but we also know that prediction doesn't necessarily point to cause and effect, right? And so expert knowledge is really important here to try to tell, quote unquote, tell the AI model what should and should not be in that model, right? And this is the causal knowledge, right? The sort of the knowledge about the structure, the causal structure of that system. And I'm going to show an example, which is like a causal diagram. We already saw some examples from Klaus. The idea is that these causal diagrams, they encode causal knowledge to help us identify which things should be in a model, which things should not be in a model. So this is just a simple example of the causal relationship that we might want to investigate between Good Samaritan, opioid overdose laws, and opioid overdose mortality. And so these arrows, they indicate the direction of the causal relationship. And the nice thing about causal diagrams is that we can add these other variables, right? So we have there a variable representing the legal environment, and that could be several variables that tell us about other laws that exist in that jurisdiction, and that the existence of those laws might be associated with the enactment of Good Samaritan laws, and may also be associated with the opioid overdose rate. There's other box underneath that says unmeasured confounders, which could be a number of other variables that we might not have available in our data set. But it's important to know because that sort of makes explicit in the model that these are things that are missing, that we should identify, and we should try to collect data in order to build a more complex, complete model and try to adjust for everything that we can in order to be able to build this causal relationships. And sort of like this, the integration of this causal thinking with AI is really, really critical to move to take that jump from prediction to causal claims. And there is actually growing use of AI in causal inference. Some of the things that Klaus already talked about. So for example, AI has been used in data processing and dimension reduction, and this was already mentioned here. Data reduction is when you have a large number of variables, right? Like say a large number of policies, and you want to identify the critical, the important dimensions or the important groups. And of course, AI, one of the main things that AI does is improve model specification by adding flexibility and capturing sort of complex relationships between variables. We can also use tools like cross-validation to identify best models that best fit the data generating process. Another use of AI is in the construction of propensity scores. Propensity scores are sort of like as the technique that is used to adjust for confounding. Basically, when you have observational data, right? Basically, you have in a causal analysis, you're going to have at least two groups. One group that receives the intervention, and another group that doesn't receive the intervention, and that is the sort of the comparison group. But because we know that laws and many other things in society are not distributed at random, right? This who receives the intervention might be very different from those who don't receive the intervention. And so propensity score is something that's used to sort of try to balance those two groups, make them more comfortable, like they are close to others. And another thing that Klaus already talked about is the robustness checks or sensitivity analysis, that it's also basically testing slightly different assumptions or testing slightly different hypotheses to show the degree to which those slightly different assumptions change your results, and that sort of builds trust in the findings that you got with the model. And just because I like diagrams in general, I should that is what we're trying to reach, the sort of the integration between artificial intelligence and causal inference, paying specific attention to the sort of the data complexities and data structure, and also adding the expert knowledge from legal equity, from public health about the distribution of disease, and also issues around equity. And so that's what I
Thank you. And we still have 5 minutes for your questions and comments.
I really like that you mentioned trust. That is, because that builds trust. You see the model. That's interesting.
I think there were some questions in the chat as well. Another one we did.
Ellen asks, I'm curious how this would apply to models of causality and behavioral change rather than predictions of infection.
Oh, that's what we wanted to see, right? How people respond to those laws. Right? What is it usually helping? Is it behavioral change? I guess if the policy is successful, right, then there's probably some behavioral change in the population that forced by the policy, because they wouldn't listen otherwise, they have to punish them. They don't. But that you can see that, right? By response, is response to the policy, right? If human health, opioid use got better, then that's the behavioral change, right? And you can figure out that by using the subgroup analysis, you can figure out the features that they are positive to change.
There's an interesting question here about the reverse causality, so that over time, law reflects the nature of the problem that it's trying to influence. How does that fit into your analysis as you look at, COVID gets worse, so there's more COVID measures?
Sure, I got this question.
Yes, that's a big thing.
Yeah.
I mean, one thing that people use is to identify first of all, natural experiments, right? Things that happen sort of randomly and or there are other tools or instrument available that's sort of similar to natural experiments. Basically, something that is associated with the enactment of the law, but it's not associated with the outcome. And by manipulating that instrumental variable, you can come up with this disentangle the effects of the law from other things.
But as you, I'm just curious as to think about this, because you're plotting things over time and able to look at feedback loops and all sorts of stuff pretty easily. But these are generally not addressed in legal. It's enough for people to say, I have a theory of that theory. So I at least have a model of how this law is going to influence COVID. And now I'm going to go launch it in the world in a natural experiment to see what happens. But that, as the questioner notes, that does not have a place for for an effect which begins with a big rise in behavior in mask wearing, and then a countervailing resistance that leads to a reduction in the mask wearing, and then a new legal intervention that changes, creates a punishment. None of those things are in that kind of. The models are static, but the models are kind of cross-sectional, but the law works longitudinally.
Actually, in statistical literature, there is a whole set of studies that look at that kind of change over time and how we can frame the problem using this potentially observable variable framework. And one of the people who asked question, they mentioned the Rubin's paper, and Rubin did a lot of work on that potential observable framework, variables framework that basically mimics the natural experiments or randomized clinical trials in administrative data sets or observational studies. And in that, you can model change over time and really estimate causal effect over time so that you can kind of understand what's going to happen in the future. But that also incorporates the statistical uncertainty so that it can speak to the generalizability aspect.
Because it's not that's not Granger causality, right? That usually does like on the longitudinal. Granger causality, right? The price to look for matching.
Yeah,
It's not really causality.
right. It's right.
Could be.
Well,
No, it's Granger causality. It could be
yeah.
unrelated.
But under certain assumptions.
But I thought propensity score matching was a little bit of
Yes.
tries
Yes.
to find these similar, very similar, even whatever you know,
Well,
and then see what.
propensity score, it tries to mimic randomized clinical trial.
It
When
exactly.
you assign it random, you hope that there is no unbalanced characteristics. So it kind of tries to mimic that. But the other tools in causal inference tries to answer several other things, like what if this person was wearing a mask when they weren't? So it's impossible to observe that because they haven't.
But that's why you try to find similar people, right?
Yeah.
But placebo kind of person, right? That didn't.
Right.
And that's what I thought the
Yeah.
propensity score matching tries to do, right? It tries to find this very similar. But of course, you can never find a perfect, very similar one, but it's yeah, that's the whole call of causality. You don't know what happened if he hadn't done it.
Right.
It was the same person.
And political science has a lot of literature in this too. Political science.
Political.
Yeah. There's a really big guy in Harvard, Gary King. He does a lot of interesting work on that. I can send you some of that.
Yeah. Because I think if this public policy works, it can be applied to other policies.
Absolutely, yeah.
It can be
Yeah.
environmental,
Yeah.
whatever it is, or political, influencing campaigns, right? These are all very interesting topics.
I think the conclusion we draw as our time comes to an end is that, the synergies and commonalities among these apparently disparate means of machine and human work are actually pretty strong.
Right.
And it is much more in the technical details and methods that you bring to bear than it is in any intrinsic element of the method. So I look forward over the next year or two to us having a lot of fun. Working through some of these things, and I thank you all for attending, for your interest. Do we have to clear out of this room right at 1 for class? Okay. Well, there might be some milling around in the hallway. We have to clear out for class. Thanks, everybody.
Thank you.
So we got-